When someone gets hurt badly enough, they normally go to the nearest emergency room. A health worker will assess the damage and assign a triage score from 1 to 5. 5 being non-urgent, 1 being the most serious. The University of Alberta studied 11 million visits to Alberta emergency rooms between 2012 and 2017. The result: First Nations people are triaged at a less important level, meaning longer wait times or the patient just leaves before getting treatment. Dr. Patrick McLane of the University of Alberta in Edmonton led the study.
For 3 of the 5 diagnoses we looked at, that's long bone fractures, acute upper respiratory infections, and anxiety disorder, we also saw that First Nations had lower odds of receiving these higher acuity triage scores.
Broke your arm or leg? You are 18% less likely to have a higher triage score than a non-First Nation patient. 10% less likely for respiratory infections. And anxiety disorders? The number jumps to 33%. Overall, First Nations people have a 7% less likelihood of a higher priority triage. Leah Bill is the Executive Director of the First Nations Information Centre, a registered nurse from Pelican Lake First Nation in Saskatchewan. She co-led the study, talking to people and elders, many who said they were not treated very well.
There was many stories shared with regards to racism, for example, derogatory things being said about them by healthcare providers, and then them leaving and not getting the care that they needed.
She says health providers need to stop stereotyping people.
There is a presumption that when Indigenous people or First Nations people present to the emergency that they're drug seeking as opposed to coming with a serious condition. My viewpoint on that is it doesn't matter whether or not you have an addiction issue. The first and foremost thing when you present at the emergency department, you should be assessed and triaged for a physical condition.
Bill says that Alberta Health appears to be listening.
We have provided them with recommendations. The good thing is that they are listening to us. And I believe that they are seriously looking at ways and mechanisms to bring about change. They do support our research completely.
But what we'd ask of the providers is that they really strive to see the patient before them as a unique individual. And we hope that these study findings are going to drive that kind of positive change and help improve the healthcare system.
Chris Stewart, APTN National News, Edmonton.